Hello, Facebook viewers. I'm Dr. Betty Chu. I'm the Chief Quality Officer and Associate Chief Clinical Officer for Henry Ford Health System and a practicing obstetrician gynecologist. I'll be the moderator for this edition of Henry Ford Facebook Live. I welcome you to the broadcast. We're really fortunate today to have two of my wonderful colleagues, two exceptional women who've really been helping us during this COVID crisis. Today we'll be addressing some of the misinformation that's been related to COVID vaccines, and I'd like to welcome my two esteemed colleagues today, Dr. Monique Swain and Dr. Allison Weinmann. Welcome, ladies.
Hi, thank you.
Hi, guys. Yeah. Dr. Allison Weinmann is an infectious disease specialist and a Henry Ford Health System leader for antimicrobial stewardship. She's really done an amazing job this past year helping us through the COVID crisis, answering a lot of our questions, but also really helping lead our vaccination efforts. Dr. Monique Swain is a Henry Ford obstetrician gynecologist. She's in practice, sees many patients. She also specializes in breast cancer treatment and provides fertility preservation counseling to young breast cancer patients. So she has a very unique perspective through this crisis, as well as the work that she does for our health system. It's great to have you both here today, to have your insight, and I really look forward to this conversation.
Thank you.
Okay. So as you both know, we're at about 4.5 million people have received at least one dose of the COVID vaccination in Michigan, which is wonderful. Sounds like a lot, but we're still only at about 55% of our population has received a vaccination. So we're not at that point where we can return to normal. So this conversation is so important today as we're trying to encourage a particular group of people who may have specific concerns and are hesitant about getting their sleeves rolled up to be vaccinated. One concern that we're hearing a lot, not only from our patients, but also from our own employees, is they have concerns during those childbearing years, those reproductive years, and they are concerned about some of the effects of the vaccines, whether short-term or long-term, to their reproductive health. So let me start with you, Dr. Swain. Where do you think this concern, this information originated about concerns between fertility and COVID and the COVID vaccination?
So there was an epidemiologist from Germany who essentially gave a hypothesis that the spike protein that is created after receiving or developed, I should say, after receiving the COVID-19 vaccine has some sort of interaction with a like protein that is found in the placenta. And from that, he hypothesized that there could be an interaction or antibodies that develop against that protein in the placenta, thus not allowing a fetus to implant or grow. And that just is not true. The spike protein that is developed from the COVID vaccine does not interact with this protein developed by the placenta, thus not impacting fertility in that way. It's just purely speculation.
Yeah, I think it's one of the challenges right now for folks is they're getting so much information online that they're having to sort through, and much of it is incorrect or simply not true or misinterpreted. So tell us more about the data to support the fact that vaccines do not cause infertility, that there's no association between vaccination and infertility.
So the Journal of New England Medicine actually published information on 35,000 plus women who are either pregnant or become pregnant after receiving the COVID vaccine, having no issues with either getting pregnant or having any increased risk of injury to the fetus or miscarriage. There is something called V-Safe, which is a program in which women who are pregnant can put any symptoms or adverse effects that they've had after receiving the COVID-19 vaccine. And none of these adverse effects have been any different from men or women who've received the same COVID-19 vaccine. So this is something safe and effective in our women who are planning to become pregnant and women who are pregnant.
That's great. Thanks for sharing that. Can you also just talk about your experience? You've had pregnant women that have gotten vaccinated, and tell us about their experience.
Yes, I've had several women in my practice who are pregnant or soon to become pregnant who've received the COVID-19 vaccine, and their symptoms or side effects after the vaccine have really been no different from mine. Some of them have had some fatigue, maybe some headache, maybe some achiness, but nothing compared to what I've experienced with patients who've actually developed the COVID vaccine disease, unfortunately. Patients who I've taken care of on labor and delivery who unfortunately developed COVID-19 have gone on to develop more severe symptoms than the average woman not pregnant, more prone to pneumonia, being ventilated. Unfortunately, I have experienced 2 maternal deaths January of this year due to COVID-19 vaccine, and I have experienced no maternal deaths of women who have received the vaccine.
Yeah, and so just to say that one more time, you've had 2 maternal deaths of women who have not received the vaccine, which is pretty consistent with the data that we're seeing, which is, there's a much higher risk, right, to a pregnant woman who gets COVID during pregnancy than there is to receiving the vaccine. So I think that's such an important point for us to highlight for the audience today. And I'm going to pivot now a little bit to Dr. Weinmann, who's had a lot of experience with explaining to her patients about vaccine and vaccination and really trying to quell a lot of those fears that we've heard from patients. Can you talk again about the overall safety of this vaccine, or I guess there's 3 vaccines that we're talking about, but what the biggest question we hear about is how they're developed so quickly, and because they were developed so quickly, they must not be safe. Can you help us understand that?
Yeah, sure. I mean, that is a really frequent question, and we had those questions at the beginning too, because these are new vaccines to us. I think first it's really important to stress that the technology isn't new. The messenger RNA technology has been around for about a decade and is actually used in cancer treatment drugs. So it's just new for a vaccine that's been widely available, but it's not new technology. So that's the first point. The second thing is that people wonder, how did it come about so quickly? It broke all records for distribution, for manufacture, etc. And what happened was that in this case, the government, at least in the United States, put up a lot of money to manufacture the vaccine before it was even known if they would meet the efficacy or the effectiveness criteria or the safety criteria. So normally what happens when a vaccine is developed is we do clinical trials and we wait and we analyze the data, and then the vaccine is manufactured, which is a very slow process usually. In this case, the vaccine was being manufactured in the background while those clinical trials were ongoing. But the important thing to note is that all of the normal safety procedures and all of the normal scientific analysis of safety and effectiveness and efficacy were done before the FDA or the Advisory Committee on Immunization Practices from the CDC released the vaccine. So this piece of it was done just the way every other vaccine is done. And so all vaccines are monitored after coming to market or being released, in this case under emergency use authorization. They're monitored for safety in perpetuity. So we even monitor for safety against flu vaccine and vaccines that have been around that we're really familiar with.
And adding to that, Allison, can you talk about, so we've had millions and millions of people that have been vaccinated with these vaccines, and certainly many of them have gotten pregnant. Can you talk a little bit about how that data is watched, monitored, and what it means to you as a scientist when you think about the number of people who've been vaccinated and many of them who've gotten pregnant, and how that helps reassure you with the question about fertility, pregnancy, and the vaccines?
Yeah, thanks, Betty. That's great questions. Pregnant women are so special because really it's all about your immune system. So a pregnant woman's immune system is sort of depressed compared to other when they're not pregnant. And the reason for that, one of the reasons, is so they don't reject their fetus. And so pregnant women are inclined to get more severe disease from certain infections. And as Dr. Swain pointed out, COVID does not spare pregnant women. And so we do know that natural infection causes severe outcomes in pregnant women, and it also causes adverse outcomes in fetuses. And we've all seen scenarios over the last year that we wish we hadn't seen. So pregnant women are a very special group and so they weren't studied in the vaccine trial specifically, and that's normal for vaccines or new medications, not usually studied in pregnant women, just because they're a little bit more of a vulnerable group in general. But having said that, there were thousands of women that became pregnant after getting the vaccine in the clinical trials, and many of which have gone on to deliver normal, healthy babies. As well as that, there's data from animal studies that there was no reproductive abnormalities associated with the resultant fetuses or babies. And the last thing is that we know that pregnant women are now, millions of pregnant women have been immunized, especially healthcare workers were very early on, and many of them embraced getting the vaccine because they were so frightened about bringing it home to their family or catching it at work or in the community. And most people have very few side effects. There are only a very small number of people, including pregnant women, that have been documented to have side effects that are severe, and they're generally very short-lived. So now we've done millions of people receive the vaccine, and even more pregnant women have been looked at. Formal studies are forthcoming. There's been no signal that the vaccine is less effective in
I just missed at the end. Could you repeat the final thing that you said? Because I lost some of your streaming.
Yeah, sure. Sorry. So, now millions of women who are pregnant have received the vaccine. And so there's been no safety signal. And we know that there's an ongoing safety monitoring by the CDC called the VAERS system, which is a vaccine adverse event reporting system, which is a really robust system that anybody can report an adverse event, a patient, a family member, healthcare professional, and then that data is analyzed on a consistent basis. And there's been no signal signaling that pregnant women have decreased effectiveness of the vaccine, which is great news, and also no signal that they have safety issues more than the general population.
Thanks for clarifying that. I appreciate it. And that really does address, we got a question from one of the Facebook Live viewers, Olivia. She said, my concern is because we've only started distributing the vaccine in January. There's not been a woman who've gotten the vaccine, gotten pregnant, and then given birth. And I think you explained that we've actually had thousands of women who have received the vaccine and have given birth with very healthy babies. And the question is, how do we know that there won't be any long-term effects with this? And I think maybe you could highlight that a little bit more, Dr. Weinmann, and then I'm going to go to Dr. Swain to ask a little bit more about pregnancy. But long-term effects related to the vaccine, what do we know, and what should we be counseling our patients about?
Yeah, so I think, any vaccine or any drug when it comes to market is continually monitored, because there may be something that comes up later. And that's why we have these robust national reporting systems to make sure there's no signal. So right now, that signaling system is working well, and we have not seen any signals. The CDC is very open and transparent about those signals. Those scientific research is continually viewed and reassessed, both by the CDC, the FDA, and independent scientists and infectious disease doctors and other experts in vaccines.
That's great, thanks. And keep the question coming for those folks that are on Facebook Live joining us today. As Dr. Swain recalls, we recently did a webinar and got some questions. One of the questions was, can I get the shot in any trimester? Does it matter when I get the shot?
So my suggestion is to get the shot, at your earliest convenience. It does not matter what gestational age you were in prior to getting the shot, whether you're in the first trimester, second, or third. There's been no signs that the vaccine has any adverse effects towards the fetus in any trimester. So I would encourage patients, if they're interested in getting it, not to delay, because in delaying, you could risk getting the COVID-19 virus, which, as we know, will further more severely impact your pregnancy.
That's great. And then adding on to that, Dr. Swain, is there a certain amount of time that somebody should wait before they get pregnant if they've been vaccinated?
So there is no set amount of time in which someone can get the vaccine. I would just encourage not to delay getting the vaccine. If that's something that you're opting to do, I would go ahead and get it. But there's no time in between when you think you might want to, start to conceive and when you should receive the vaccine.
That's great. And I wonder too, as somebody too who thinks a lot about all the vaccinations as an obstetrician, we counsel our patients on, and I think putting that in context with the COVID vaccine and all of the vaccines that we recommend in order for moms to be healthy and their babies to be healthy. Could you maybe talk about that a little bit and maybe help us with that context?
Absolutely. So for years, we have been encouraging women to get vaccines during pregnancy, specifically the flu vaccine, because we know that when women get the flu, they have a higher risk of not only lower respiratory disease, but also something called ARDS, which is acute respiratory distress syndrome, which is something that is really detrimental to a woman in pregnancy. We also encourage something called the Tdap, which is a vaccine not encouraged just by OBGYNs, but also by pediatricians to help reduce the risk of whooping cough or pertussis in infants when they're born. So it's to help for the infant to have immunity against such diseases when they're born. So we've been recommending vaccines for years in pregnant patients. So this is no different than those two vaccines.
Thank you for that. And Dr. Weinmann, can you clarify, how long does it take to be fully vaccinated if somebody were to get the shot? And I appreciate your point, Dr. Swain, that people shouldn't wait, in terms of getting pregnant, but how long does it take for it to take effect?
Yeah, so it depends whether you're getting a one-shot or a two-shot series. So the Johnson & Johnson is the one that's currently available. It's a one-shot series, and it's usually, general rule of thumb for any vaccine is a couple of weeks, at least 14 days after your last shot to reach maximal immunity. So the Johnson & Johnson, it's 2 weeks after the first shot. For the mRNA vaccines, the Pfizer and Moderna, it's 2 weeks after your second shot. So that's there's 21 days in between the two shots, or 28 days in between, and then an additional 2 weeks beyond that.
Okay. All right, and Dr. Weinmann, I'm going to call upon you on this one because this is a good vaccine scientist question from Diane on Facebook here. It says a study showed a lower antibody response in kidney transplant patients, especially with Pfizer versus Moderna. If you've already had the 2 Pfizer doses, can you revaccinate with Moderna later? Is that recommended?
Yeah, so I haven't seen the study you're referring to, and I haven't seen any studies that have compared head-to-head. So it's really important to know that every single one of the vaccines that are available are highly effective. In fact, much more highly effective than we ever dreamed of. The FDA's bar for releasing these vaccines was 50% efficacy or effectiveness. And actually, they are much higher than that. So 70, 80, 90 plus percent efficient. Now, no vaccine is 100% effective. So it's true that if your immune system is suppressed, like a transplant patient, you're likely to be in the category of somebody that doesn't reach that maximal immunity. It doesn't mean that you're not immune, though. And the beauty of these vaccines, which is unlike most other vaccines, is even if your immune system is suppressed, these vaccines tend to protect you against what we're most interested in. It's severe disease, hospitalization, and death, right? So that's what vaccines are really designed to do. So if you get a mild case of disease, that's okay, because as long as you survive that. So that's what we're trying to protect. So the other important part is that around somebody whose immune system is not as robust as somebody else's, you really want to get that herd immunity. So everybody surrounding them should be immunized to bump up their own, decrease their risk of getting exposed to COVID. So there are going to be populations that do have less good effectiveness from vaccines, and that's true for any vaccine. And that's why it's really important to get the majority of people immunized.
It's such a great point. And I think so. The answer to your question, right, in terms of the revaccination is we don't know yet, but it sounds like the person's gotten 2 doses of Pfizer as a transplant patient and should be in a very good state in terms of their vaccination. My other question to add on to that, it wasn't in the chat box, but I know a lot of people are thinking about boosters. And Dr. Weinmann, I'm wondering if you could share any thoughts you have on when we're going to hear about a booster, or if people are going to need a booster.
Yeah, well, right now, there's still studies ongoing to find out how long immunity lasts for. That's what we're all really interested in. We know with other coronaviruses and vaccine, immunity usually lasts about 1 to 2 years. That's what we think. Studies so far have shown that up to 6 months, and people are using that as a cut point, then immunity wanes. That's not true. The studies have just shown that 6 months, you've got great immunity, and it's probably much longer than that. So with all the variants that are coming up, we probably will need boosters. It may turn out to be an annual shot or a semi-annual shot every second year or so. We just don't know yet. So that data is still forthcoming. So it's probably, I think, most unlikely that you'll be just, one time and done. Coronavirus is a very clever virus. It mutates and changes all the time. And I think it's going to be with us for some time to come yet, unfortunately.
Thanks for that. So I'm going to pivot back to questions about reproductive health and women's health. And Dr. Swain, we get this question a lot. Does the vaccine increase the chance of miscarriage? And then I'll add on to that, can the COVID vaccine cause birth defects?
So in terms of miscarriage, looking back again at the New England Journal of Medicine, they calculated the miscarriage rate to be somewhere between 10 and 20%. And depending on what you read, there was one study that showed as high as 18% and another show as low as 12%. The general population of miscarriage is somewhere between 10 and 20% on average. As you get closer to 45, the miscarriage rate is actually 50% in the general population. So when you look at someone who's received the COVID vaccine, it's right in where the general population is, between 10 and 20%. So it does not increase the risk of miscarriage. Unfortunately, miscarriage rate is about 1 in 5, and that's exactly what it is for women who are receiving the COVID vaccine. Now, in terms of birth defects, no, there have not been any accounts that the COVID vaccine has caused any birth defects outside of the norm of what it is in the general population. So it neither increases risk of birth defects nor increases risk of miscarriage.
That's great. What about women that are breastfeeding? Should they be vaccinated? And then I'll ask the question, do we have any early data or scientific evidence around any benefits for breastfeeding moms to be vaccinated to help support the baby? So I'll start with Dr. Swain, and then I'm going to pivot to Dr. Weinmann to ask that question as well. Monique?
So simple answer is yes. It is okay for breastfeeding moms to receive the COVID vaccine. And there actually has been some evidence that there are antibodies that are found in breast milk. And this could also help develop immunity in infants who are breastfeeding. So it's actually a win-win situation. So I would definitely encourage women to consider, if not receive the COVID vaccine while breastfeeding.
Great. Dr. Weinmann, do you have anything to add?
Yeah, I would thoroughly endorse that. And then I would also just say that, there's also the other myth around pregnancy and the vaccines is that these are called messenger RNA vaccines, the Pfizer, Moderna, and there's a fear that it incorporates into human DNA and therefore can, damage the woman or the fetus. And that's just not true. So we make messenger RNA all the time to make the essential proteins so that we can live. So our bodies are really efficient at getting rid of messenger RNA. And this messenger RNA that is being injected in the vaccine is just a very small portion of the virus called the spike protein, against which all the vaccines are directed to provide immunity. And it doesn't get anywhere into the cell near the human DNA, which if you remember back to your high school biology, if you did biology, it's in the center of the cell in the nucleus. That's where the human DNA is stored. And this messenger RNA stays in the outside part of the cell and actually can't get into the nucleus. So there's no interchanging of genetic material between the two, the messenger RNA that's injected and your DNA.
Yeah, I really appreciate you making that point. I have heard that concern as well, too, from patients. And I think just clarifying that this does in no way change your DNA by receiving the vaccine, simply allows you to create antibodies to protect you from the virus. That's really the function of the vaccination. So thanks for that, Allison. I really appreciate it. So I'll go back to you, Dr. Weinmann. So being vaccinated comes with benefits. We're all looking forward to the day when things will be normal. It's hard to imagine a place where we went to a football game and we didn't have masks and there were 105,000 screaming fans, or we walked through an airport and we didn't think twice about how close we were to other people. So what will being vaccinated allow us to do that we've not been able to do during the pandemic? And tell us a little bit more about this idea of herd immunity and why it's so important.
Yeah, so what aspect of life has not been different under COVID? I can't think of any aspect of life that has been the same. And we are all really, really keen to, engage in, see our loved ones, see our friends, see our family in the same way. I think I would just caution people right now that we're not quite there yet. So the concept of herd immunity is that you get enough people vaccinated, so there's just fewer people for the virus to feed on, and viruses need to live in humans. So if you have fewer susceptible people, there's going to be less virus circulating in the community and less concern that people are going to become infected. So we're reaching that level now, and as the governor's got some goals in mind, about when you can return to work, when you can, and you'll see those recommendations continuing to evolve and change, both at the federal level and the state level. So basically, the more people that get immunized, and we reach that 70, 80, hopefully 90% immunization rate, people will be able to do more and more things. So as a vaccinated person right now, along with other vaccinated people, your level of comfort should be fairly significant, especially if you're outside. So outside is always going to be safer than inside, and inside with other immunized folks of a small number of households could be done without masks now. So that's a big benefit. And as time goes on, we're going to see more and more of those benefits as more and more people get vaccinated.
That's great. Yeah, I was recently having a conversation. I'm sure you're familiar with this concern. People say, well, if I get vaccinated, I still have to wear my mask. So why do I bother to get vaccinated? And I think your point about that, there's obviously protection for ourselves individually as we get vaccinated, but also we have to get to a certain amount of people in the population who are vaccinated in order for all of us to take our masks off. That's really, I think, what's important in this conversation. So we really need people to get vaccinated so that we can all get back to normal. My kids can go back to school. Monique, your kids can go back to school. You know, we would love for that to happen this fall, I think. So, you know, going to a couple of things that we've heard also. Monique, I recall the last time we had this conversation, there were some questions about male fertility, and I don't know if you want to go down a little bit of that path. You know, there's some concerns people have expressed about male fertility and also about menstrual cycles. If you recall, there were some questions about, is this going to impact menses? May be important as we get into that adolescent group, of which I'll ask Dr. Weinmann about the new recommendations. But tell us a little bit about the impact on the vaccines on male fertility, but also, again, pivoting to the other end, menstrual cycles in women.
Absolutely. So in terms of male fertility, there hasn't been any evidence to show that the COVID vaccine negatively impacts male fertility. However, there has been some evidence showing that actually getting COVID virus actually can maybe impact male fertility. So if we have to choose between the two, I would think I would rather get vaccinated than get the virus if that may impact male fertility. Now, in terms of the menstrual cycle, again, there is a registry where patients or those who receive the vaccine can enter any kind of side effects that they may have had or adverse effects after getting the COVID vaccine. There has been some menstrual irregularities that have been seen, but nothing long-term. So this is nothing that someone needs to worry about. It's not going to impact, ovulation or their ability to get pregnant. You may or may not see an impact in your menses after receiving the COVID vaccine. There's no significant evidence, though, to show that this indeed is a kind of chicken before the egg before the chicken type situation.
That's great. And Dr. Weinmann, I'll pivot to you then regarding the question around adolescents. And this, of course, is really timely given the decision this week by the FDA. So maybe you could talk about that a little bit.
Yeah, so again, pediatrics were not studied in the original studies. Usually we preserve those for healthy young adults. So studies are usually done in healthy adults. And then in this case, the original studies were done in also not healthy adults, but also older adults and people with some immunocompromising conditions, but pediatrics were excluded. And so as more data accumulates, and I was just on listening in on the call of the Advisory Committee on Immunization Practices who are going to vote today about whether to extend the age group down to 12. So that would be really exciting because not only do you get immunized for yourself, but you want to protect the people that can't be immunized, either because they're not in an age group where the vaccine is yet approved, or they have some other reason they can't get the vaccine. There are very few other reasons apart from severe allergic reaction to the vaccine or its components. So it's really exciting that age group is going to be expanded. And I anticipate that over time, as more studies and more data come in, and again, there's no even theoretical reason why children who have intact immune systems, which is, and even children that don't have thoroughly intact immune systems, should do worse than adults in those similar circumstances. So I think over time we're going to see the age group extended even further downwards. I don't know what the CDC is going to vote today, but I'm hopeful that they're going to extend the age down to 12. And just think what that does for families. So it means if you've got young children above the age of 12, your entire family group can be immunized. Whereas other people who have very young children, it's really just the adults. So it'll be a remarkable moment for people's households when everybody's safely immunized, and lots of implications for going back to school, kids getting back to socializing with their friends, etc. There's a lot of benefits to getting your kids immunized once it becomes
That's so true. I can't wait. I think I've told both of you, I've got a 13-year-old at home. I can't wait to get him vaccinated. Every time, if we do go out somewhere socially indoors, of course, wearing our masks, I always put him in the corner because he's the one non-vaccinated guy in our family. But no, I agree with you. I'm looking forward to it. And I would love for the kids to get back full time in school and be able to do the normal things that they really should be doing at this age and not thinking about things like a virus. So absolutely. So we're coming close to finishing up the hour. I'm just going to scan to see if there's any other additional questions that we have from Facebook viewers. If there are any questions, please feel free to put those so that we can answer those questions for you. Dr. Swain, I guess I'm going to give some time for both of you to give some final thoughts. And, one thing that I know we've talked about before and that you've been a real advocate for is ensuring that our underserved minorities and that our population, our vulnerable populations, especially in the African American community and the Hispanic community, Henry Ford has done a lot of work, really try to reach out to those particular communities that have lower vaccination rates. Tell me more about your thoughts around what we can do to increase vaccination rates in those communities.
So this is something extremely concerning to me. I think too we need to look back at the history of medicine when it comes to people of color and how disenfranchised, unfortunately, people of color have been throughout the history of healthcare. And I firmly believe that that's in large part what allows people that look like myself to have reservations. And as I've admitted to you before, and some of my other colleagues, I wasn't the first one in line either to get the vaccine when I first heard about it. I'm one of those that, let me read about this first and see what's going on with this before I jump right in. And I just want to let my colleagues know, and also to my patients know, and those that I take care of in the community here of color, is that it's just truly important for us, to really ask those that have experience with healthcare and medicine, those that you trust. It's important to make informed decisions, take the risk versus benefit and look at that and say, how does this benefit me? Is this generalizable to those that look like me? I'll give you an example. Unfortunately, those of color were about 2 times more likely to be hospitalized from COVID and 4 times more likely to die from COVID. And the 2 pregnant women that I unfortunately witnessed pass away from the COVID virus were women of color. And that's something that doesn't sit well with me. And it's really, really important that we protect and take care of ourselves, and we take this information and we do what we can to protect our community and those around us. So if you ever have questions, concerns, go to a healthcare provider that you trust. Make sure you're reading just like we all are. And if things aren't making sense, it's okay to ask. It's okay to advocate for yourself. And I just know that I'm here to advocate for you as well and protect you too. So we're here to really to do the best for you. And I hope that you are listening and hear this.
Thank you, Monique. I really appreciate your advocacy and your heartfelt call to action, in that regard. And, certainly we already know that maternal mortality in this country is much higher for African-American women. And so this vaccination effort is even more important, I think, in that population as well.
Absolutely.
Yeah. So Allison, I guess I would ask, for your final thoughts, and what I'd love to also hear from you is, because you've had this conversation so many times with hesitant people, how have you been able to convince people who are hesitant? And, can you think back maybe to something that you heard that you thought, oh boy, I really, if I can explain it, and you provided some education for that person, what were you able to explain to them that was helpful?
Yeah, I think a lot of people have. First of all, I think the main question we get asked, especially at the beginning of the epidemic, was, is it safe? And I think we covered at the beginning, what was it that sped up this vaccine? And I think a lot of people, once they know that this vaccine process was no different than any other vaccine that we take willingly, we hold out our arms for all kinds of vaccines. I think that's very reassuring. And I just want to emphasize, none of us were, until we saw the data ourselves, until we saw the science, we were all kind of like, well, let's wait and analyze things and see it. And so as providers, I think one of the major things we can do is provide information. And I think that's tremendously reassuring to people. And the fact that, people who said, I don't want to be first, you're not first, you're like millionth. There's millions of people have been immunized now, so you haven't been first. We were in the first group that got immunized, healthcare workers who were at high risk. And, I got to say, everybody was a little bit apprehensive, even though more people were involved in the clinical trials for these vaccines than any other clinical trial for any other vaccine. So it takes, I think it's just getting people the information they need without them having to parse the scientific data and to trust that their providers have really looked at this carefully and closely, and our healthcare system has really analyzed the data ourselves. We haven't trusted the drug companies to just, give us the data. We've actually looked at the data ourselves, and we are convinced that these vaccines are safe and effective. And if they weren't, I wouldn't have taken the vaccine. I wouldn't have endorsed it for all of my family, and I wouldn't be recommending it for my patients. And I still think that your provider is the best person to speak to, who knows you, knows your health. And the other thing that we hear about is people are very concerned about their own individual health issues. And who knows you better than your provider? So if you have an individual health issue that you have a question about, that's the person to go to speak to about what your individual concerns are. And I think that one-to-one interaction is often extremely helpful in reassuring people.
Thank you, Allison. And I know your department in particular has led many of the clinical trials for vaccines. I was fortunate myself to be a part of the Moderna trial, as you know, and willingly held out my arm. And so I really appreciate all the work that you've done. I also appreciate, again, the information you've shared, Dr. Swain, for our women. As so many folks have concerns about pregnancy and fertility, and hopefully they've been able to get the right information with this webinar today. Also, I'd advise our viewers to go to the henryford.com /vaccines site. You can also, if you go to henryford.com, sign up and schedule your vaccine appointment. It's very easy, open scheduling. You can see our slots or times or locations. So if you are in the Metro Detroit area or in the Jackson area, you can schedule a vaccine appointment right after this webinar, because hopefully we've been able to motivate some of you or convince some of you that it's the right thing to do. With that, I so appreciate, again, my colleagues for joining us today. It's been a wonderful discussion, very informative, and hopefully we are able to sway the hearts and minds of some, or have you start looking at more information and hopefully get you to come to the decision that we believe is the right decision for you and for your families. If you haven't done so already, again, please go to the henryford.com webpage. But with that, I will turn you all back to your afternoon. And again, thanks so much, Monique and Allison, for joining us today.
Thank you for having me.
Thank you, everybody. Stay safe.
Thank you.
Thank you. Bye.